This is the frontal bone. It has got two parts, the upper vertical squamous part and horizontal orbital plates. It's a flat pneumatic bone. It is pneumatic because of the presence of frontal air sinuses. The function of frontal air sinus is resonance of voice, which means it will add sharpness to the voice, humidification of air, and lightening of the cranial bones. Other pneumatic bones are ethmoid bone, maxilla, sphenoid, and temporal bone. The junction of upper vertical squamous part and horizontal orbital plate is the supraorbital margin. It is concave and sharp in its lateral 2/3 and blunt and rounded in its medial 1/3. The junction of lateral 2/3 and medial 1/3 is the supraorbital notch, which will allow passage of supraorbital vessels and supraorbital nerve. Supraorbital vessel is the branch of ophthalmic artery, which is one of the branch of internal carotid artery, and supraorbital nerve is the branch of ophthalmic division of the trigeminal nerve. Medial to that is the supratrochlear notch, which is not visible, which will allow passage of supratrochlear nerve and vessels. This is the zygomatic process, which will articulate with frontal process of maxilla, forming frontozygomatic suture. The upper border of the zygomatic process will be continuous as the superior temporal line, which will provide attachment to the temporal fascia and lateral aspect of the galea aponeurotica, and inferior temporal line will provide origin to the temporalis muscle. And this is the nasal part of the frontal bone, and this is the nasal notch. Nasal notch articulates on each side with three bones, from medial to lateral, nasal bone, frontal process of maxilla, and lacrimal bone. And this is the point of nasion. We can define nasion as the meeting point of frontonasal suture and the internasal suture. Above each supraorbital margin, the surface presents a curved elevations, the superciliary arches, which is more prominent in adult males because of the presence of frontal air sinuses. And the imaginary meeting point of the two superciliary arches is the point of glabella. Now we will discuss about the squamous part of the frontal bone. It has got external surface and internal surface. External surface is smooth and covered with frontalis muscle on each side, and the epicranial aponeurosis intervening between them. The external surface displays an elevation on each side, which is called frontal tuber or eminence. It is more prominent in children and females. The inner aspect of the frontal tuber lodges the frontal pole of the cerebrum. Now we will discuss about the inner aspect of the squamous part. It has got multiple pits because of the gyri of the frontal lobe and vascular markings because of the presence of meningeal vessels. It has got frontal crest, which will bifurcate to form sagittal sulcus. Here we can see the bifurcation of the frontal crest, which will lodge anterior-most portion of the superior sagittal sinus, and borders will provide attachment to the falx cerebri. Falx cerebri is nothing but the dural fold. Here we can see the foramen cecum. No significant structure passes through it, but sometimes it may lodge an emissary vein, which will communicate with superior sagittal sinus and veins of the nasal mucosa. It can act as the safety valve in case of increased intracranial pressure, without producing vascular damage to the brain. And now we will discuss about the orbital part of the frontal bone. It has got orbital surface and cerebral surface, and it is forming major part of the roof of bony orbit. Orbital surface anterolaterally presents a depression, which will lodge orbital part of the lacrimal gland. And anteromedially it presents a depression which will provide attachment to the fibrocartilaginous pulley, through which superior oblique muscle passes through and changes the direction of the eyeball. Orbital part of the frontal bone has got three margins: medial margin, posterior margin, and lateral margin. Medial margin articulates with upper surface of the labyrinth of ethmoid bone, posterior margin with lesser wing of the sphenoid bone, and lateral margin with greater wing of the sphenoid bone. Let's take a look at the base of the skull. This is the frontal crest. Below to that, this is the foramen cecum, and this is the crista galli. On either side of the crista galli, there lies the cubiform plate of the ethmoid bone, which is perforated and will allow passage of olfactory nerves. This is the lesser wing of the sphenoid bone, and this is the orbital part of the frontal bone. Together, they will form floor of the anterior cranial fossa and will lodge anterior portion of the cerebrum. Now we will discuss about the articulations. Anteriorly nasal notch will provide articulation to three bones from medial to lateral, nasal bone, frontal process of maxilla and lacrimal bone. And the zygomatic process articulates with frontal process of maxilla forming frontozygomatic suture. And posteriorly, the parietal border articulates with frontal border of the parietal bone forming coronal suture. And the ossification process for the frontal bone is intermembranous. This is all about the frontal bone.